My name is Swathi. I came to Russ Foundation 8 years ago. I was brought here by my father after my mother's death. My mother died of tuberculosis. I have 3 sisters and one of my sisters cannot walk. My father was diabetic and he died when I was 16 years old. I have finished my schooling and I am pursuing nursing. After this I wish to study MSW. My name is Divya. I came to the Russ home in the year 2006 when I was 9 years old, studying in the 4th standard. From then till now, in 12th grade, I have lived here happily without any problems. I came here as I don't have parents and due to some family problems after their deaths. I am happier living here than with my relatives. Also, I would not have got so many brothers and sisters had I lived there. There are plenty of trees, birds and animals here. We are fortunate to have a place like this. We are all very happy living here with lots of fun and togetherness. When we are naughty, our uncle does not take it seriously. He will talk to us in a nice way to make us understand and help us to overcome problematic situations. He counsels us to come out with good solutions and he takes care of us with great protection. My ambition in life is to study MBBS to become a doctor and to serve in Russ Foundation and work under our uncle. From my earnings, I want to help poor patients. This is my wish. My name is Satya. It's 14 years since I came to the Russ home. After my schooling, I am joining a diploma course in nursing. I am really fortunate to live in a safe and secured home like the Russ home. My name is Daniel. Till such time I get a job and settle in life, I have my uncle to be with me and all the staff here are very supportive.
Russ Foundation was started in the year 1992 with the main objective of helping children without parents. When we started the children home, we had only 3 children. Over the years, the strength have grown up to 35. We started this home in a rented building, and when we moved to our own premises, we had around 20-25 children. Today there are 35 children who are all either without both the parents, some are with single parent. We have also integrated children with HIV. These children are infected from birth through mother-to-child transmission. In the year 1996, we had a retired English health nurse by name Miss Olive Jeffries who came to Russ Foundation to work with rural villages. We had the first HIV casualty in one of the villages, and that's triggered us to look into the health program in a different angle. Russ Foundation was invited to apply for a grant with Bill and Melinda Gates Foundation in the year 2004, and we started working with 2,400 female sex workers in Madurai district alone. Today, this program have extended to 3 districts, Madurai, Theni and Tuticorin, where the HIV program is going on with the support of big staff strength to address on the HIV prevention needs.
I am Vinodini. I am working in Russ Foundation as a link worker in Theni district. My working area is Bordi, and the main objective of my job is to prevent new HIV infection amongst the general population and people with high-risk behaviours. We create awareness among such high-risk populations and motivate them to go for an HIV test. Moreover, there are many such people who isolate themselves due to self-stigmatism and stay indoors. We provide suitable counselling to help them come out of the stigma and motivate them to come for testing and treatment. We also tell them about the myths and misconceptions they have about HIV, and we educate them that they could also lead a normal life like others. Many people have got awareness and sensitisation on HIV through this program, and they are under ART treatment and lead healthy lives.
Another challenge is that HIV-infected children are also not having an access to stay in homes after they complete their school studies. No home is willing to take up children after the age of 16 or 17 years when they finish their schooling. Nobody wants to educate them for university studies. When they leave the home, they become a misfit in the society. because they don't have the money or they don't have the people to care for. We provide education up to university level, and sometimes even we support up to the master's degree depending on the aptitude. We also help them to get a job and settle in life.
My name is Mutupandi and I come from Mutupati village. I lost my parents when I was very young and my aunt had put me in a home. I was so mischievous that the sisters there did not want me and they sent me out of the home. After that, I came to Russ Home and I was given good care. After schooling, I joined a technical course in automobile mechanism and have also learnt to drive. After my training, I am working as a mechanic in a private workshop specialising in wheel alignment. Russ Foundation had helped me by paying for all of the costs for my schooling and training, fees, textbooks, and my bicycle. As I was infected with HIV from birth, I am taking ART tablets and my health condition has improved. All my medical treatment and costs during my illness were borne by Russ Foundation. Today, I am healthy because of Russ Foundation. My name is Arumagam. I do not have parents and both of them died of HIV and AIDS. Now I am living with my grandmother and Russ Foundation provides me with help for my education and has provided rice and groceries regularly for the past year. I wish and hope that Russ Foundation will also continue to help me and my grandmother in the years to come.
The main challenge for Russ Foundation is that children do die at an early stage because of malnutrition. Nutrition plays a vital role for HIV-infected children. We provide nutritional support for nearly 70 children every month, and a package is given for HIV-infected children. It is a big challenge for us that we are providing this with the support of well-wishers from England and also from India. Apart from this, we also provide nutrition support for MR children, mentally retarded children. 20 children are benefited from this program. Many of the HIV children are referred to Russ Foundation because not many homes are there in the district and also in the nearby districts. They do not have the provision to take HIV-infected children in homes like ours. Russ Foundation creates a lot of awareness on HIV among the transgenders and MSM community. MSM is also called as gay community. Special treatment and care is given to these people apart from providing awareness and condom distribution among these people. We are also providing rehabilitation services like getting them opportunity, referring them for educational institutions, getting them job, and also sometimes we also address onto their personal needs like addressing the discrimination problem within their own family and their own immediate neighborhood.
My name is Suda. I come from a rural village in Tuticorin district. In our village, people like me, transgenders, come to dance by tradition. Somehow they identified me also to be like them and asked me to join them to go to Mumbai. I was only 14 years old. When I was there, they did an emasculation surgery on me. After a couple of years in Mumbai, I returned to my native village, and when I went home, my parents and older brothers found out that I had had the emasculation surgery. They beat me very badly and bruised me till I bled. They chased me out of the house and the native village. At that time, one lady came forward to help and offered me shelter. I started to ask for money in shops by clapping my hands. I beg in trains, and in the evenings I go for sex work. Sometimes we get into problems such as hooliganism and bullying. Whenever we have such problems, we come and inform the Russ Foundation office and they come to our rescue. Apart from that, the Russ staff help us to get regular treatment and checkups for HIV and STI problems. Russ Foundation distributes condoms for safe sex practices with the help of the government and educates people like us to prevent HIV and provide training for alternate life skills for rehabilitation. I am Jagadisan from Dombucherry village in Terni district, and I am a daily wage earner working in the agricultural fields. I am homosexual but got sensitised on HIV and condom usage only through the Russ Foundation. Now, I don't have any encounters without a condom, and I also distribute condoms to other partners and other MSM. Now, I go for regular checkup and tests for HIV, and I am grateful to Russ Foundation for giving me a new life. My name is M.A. Selvi. I have 2 young children. My husband deserted me and my children after infecting me with HIV, and he left me in the streets. I even thought of putting an end to my life after thinking about killing my children. When I had no other option, I was forced to come into the sex industry due to poverty and in order to feed my children. One day, when the Russ Foundation staff identified me and took me to the Russ Clinic, they did a speculum examination and found out that I had an STI. I was sensitized about condom usage and safe sex practices. Russ Foundation helped me and my children in many ways that today I lead a life with confidence. Today I am independent and lead a life with confidence and dignity, and all the credit goes to the Russ Foundation for their financial, medical, psychological, moral and emotional support.
As of today, Russ Foundation works from cradle to grave, providing different kinds of support services for HIV and also in the general community. From birth till death, we provide end-life care for HIV patients, and it is a big demand for HIV patients to have a hospice or end-life care center, which is lacking. So we are taking all the efforts to have a hospice center in our campus, and if everything goes well, Russ Foundation will be having a hospice soon to provide and cater to the needs of the patients who are towards their end of their life. And we have a specialized team already who are working in the home-based care program. They take care of the funeral part of it. Sometimes the family relatives, they themselves keeping themselves away from the dead person in spite of being closely related. So our special team go and conduct the funeral services, and this is another specialty, and that's why Russ is very special.